can you get these antibody tests? We've heard of these antibody studies being done in New York and being done in L.A., but how can we get our hands on antibody tests here in Montana? Anyway, I got an email after the show from our friend Matt Desch with B Broadcasting and KJJR Radio in Kalispell. He said, hey, I tell you what, he said, the woman to talk to is Katie Foultner with Valley Medical Services in Kalispell. She's now with us here on Montana Talks. Katie, thanks for being with us.
Good morning, Aaron.
Yeah, it's great to have you on the show this morning. So what about these antibody tests? Are they available here in Montana? And tell us how we can get our hands on them.
Sure. So Valley Medical Services is currently offering antibody testing for anyone who wants to have a test. Our test includes both the IgG and the IgM antibodies. So not all antibody testing, as of right now, is offering both antibodies, but they're very important. The reason being is that the IgM antibody shows recent or even possible current infection, where the IgG antibody shows past infection. So we're able to identify where people are in the possible infection process.
That's very interesting. And it's definitely for COVID-19, or because I know some of the antibody studies that have been done elsewhere across the country, sometimes it can pick up any coronavirus, but obviously people are more interested in the specific COVID-19. So is it COVID-19 focused as well?
Sure. So the laboratory that we use uses a targeted advanced molecule for COVID-19. So it's not to say 100% that it's not likely or that it won't interact with other coronaviruses, but they're able to differentiate them with the technology that they're using. So the platform is highly sensitive and accurate, especially since they're testing for both antibodies.
That's very interesting. So right now, if, say, somebody in Big Fork wanted to get the COVID-19 antibody test through Valley Medical Services, what's the process look like? What's the test like? How much does it cost? How widely available is it?
Sure. So patients would just want to call and schedule an appointment. It's a simple blood draw. Typically, we have results back 2 to 3 days after the draw is done and the laboratory receives the specimen. The cost is $175. However, we are being told that this should be a reimbursable expense by insurance companies. So we can't bill the insurance, but we can definitely provide patients with an invoice for them to self-submit.
Oh, interesting. And by the blood test, I know some of the COVID-19 tests are just as simple as like even just a prick of the finger. Is that how it works for the antibody test, or is it a little more, does it require a little bit more than just the prick of a finger?
It's more than a prick of a finger. It's an actual blood draw. And what I know about the prick of the finger test is they're a ELISA-based test, and they're a lot less accurate. Typically, they have an accuracy rate of about 80%, where the tests that we are performing, their sensitivity is 95.6, and their specificity is 97.5. So to explain that better, the sensitivity is the true accuracy rate, and the specificity is the true negative rate.
Interesting. And how long have you been doing these COVID-19 antibody tests at Valley Medical?
Over the last 2 weeks. And kind of how we got started is when everything was happening in our area, patients would call wanting to know if they could get tested for coronavirus because our local hospital didn't have the testing capability to be able to offer everyone a test that wanted one or even possibly had symptoms. So one of the laboratories that we've worked with over the last 6 years had reached out, and they definitely have an advanced platform for testing. The studies that they have are done, they're human studies, and they use a sample size of 200 people. So for every 200 people that had a positive COVID-19 test, which is, they use the RT-PCR type of testing for the actual diagnostic testing, but all 200 of them also had the positive antibody test. So they feel very confident in their testing platforms.
Well, that's very interesting. Well, less than a minute to go before our next break. Unless you can stick around for just a couple more minutes after our next break, I do have another guest coming up here a little after 8:20. But with about 30 seconds to go, what's the most important thing that you think we will learn from these antibody tests, or what's the most important thing that you think folks need to know?
the most important thing is that, especially in our valley right now, our numbers aren't accurate because people who are even experiencing symptoms weren't able to get tested. So this antibody test is so important so that we can accurately be able to predict where Montana is, or even our valley is, in the infection process.
Jeff in Polson, thanks for your call. Did you have a quick question for Katie Foultner?
Yeah, Katie, in the middle of war, it's really difficult to assess things. There's a whole bunch of studies, hundreds of studies going on about dozens of things. But recently, two studies kind of piqued my interest. One was showing the benefits of vitamin D, potential benefits, and the other one was showing the potential danger of dextromethorphan, an ingredient in cough syrup, in terms of that it might actually aid the replication of the virus. And so I was wondering if you could talk to both of those.
Oh, very interesting. All right. Well, thanks for that, Jeff. Great to hear your call. Katie, your thoughts, because I know you're getting some good guidance from your doctors there at Valley Medical Services as well about how to boost your immune system. I think that ties in with that vitamin D question.
Yes, definitely. So one of the best ways for prevention, what our physicians are saying is that people should make sure that they're taking vitamin D, vitamin B12, vitamin C, zinc, and then 4 ounces of tonic water every night as a preventative measure. So vitamin D is huge because it greatly supports our immune system.
Which is also like getting outside and getting some sunshine, right, basically?
Yes, and in the valley here, we don't get as much of it as other parts of the state, for sure.
Yeah.
So we do have a deficiency, but it definitely aids in making sure that people's immune systems are able to function well should they come in contact with this virus. As far as the cough syrup question, I haven't heard anything about that. I don't have any information on that one.
Yeah, but that's interesting to hear about. Well, Katie, thanks again so much for joining us here on this show. Any final thoughts that you wanted to share that we didn't get to yet?
Yeah, one thing I did want to mention, so one of the greatest advantages of having these antibody tests performed is it allows, especially people who have the antibodies, to go into situations where maybe they need to take care of somebody who is sick with the virus, or for healthcare workers, or even if they have been exposed, employers are able to put them back into the workforce, and it allows us to be able to better assess the businesses that you can open sooner than later. And so it really provides that kind of advantage for our community.
Yeah, that makes sense. Well, and I know, the medical community is obviously kind of like what Jeff, hinted at. There's all these studies going on. So in the middle of the fight, it's hard to know, concretely, but there's also this thought that if you have the antibodies for COVID-19, that you've basically developed an immunity to it. So that's the other hope here as well, right?
Definitely. And for those who don't have the antibodies, it helps identify people that are more at risk and need to take, maybe a little extra precaution, depending on whether they have underlying health conditions or, different factors that would put them in that category.
All right. Well, Katie Foultner with Valley Medical Services, again, thanks to you for joining us, and thanks to Matt Desch with B Broadcasting for connecting us with you in KJJR Radio in the Flathead. Do you have a website, phone number if people want to find out more information, if they want to inquire about these antibody tests? And what advice would you give to people elsewhere across Montana as well?
Definitely just, if you're in search of an antibody test, you can contact your local health clinics to see if it's a test that they are possibly able to provide. We do not have to have a physician's order, so people are able to call and self-order these tests. Our telephone number is 406-257-1680. When people receive their test results, our physicians follow up. They call them and follow up, answer any questions that they have. It's all part of the cost, so there's no additional cost in any way to that. And then our website is www.valleymedicalservices.net.
All right. Well, great. Thanks again, Katie. It's been great to have you on the show this morning.
Thank you for having me.